This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Peripheral artery disease, or PAD. It sounds pretty obscure, doesn't it? Well, it's not. More than 8.5 million Americans have PAD.
Now, as a matter of fact, March is Peripheral Artery Disease Month. So what do you say we get you up to speed on this disease that can not only be dangerous, it can also be deadly? To help us do that, this is Dr. Douglas Wilhite, who is a vascular surgeon at Peninsula Regional Medical Center. Thank you, sir, so much for coming in.
Thank you very much for having me.
So tell us about PAD. What is peripheral artery disease?
Peripheral arterial disease, it just refers to when we have plaque that blocks up the arteries that feed our periphery, our arms and our legs. For most of us, it affects the legs. For some people, it affects the arms. And it comes from plaque growing within our vessels.
Are there people who are more at risk for getting it than others?
There's a number of people that are. It starts with age. All of us by the age of 60 have about a 5 or 6% chance of developing PAD. And then some behaviors, especially smoking, is a very important risk factor. And some of it's genetics. If you have diabetes, a high cholesterol level, all of those things combine to increase your risk of having the disease.
Are there any symptoms we can look for that?
The most common symptoms are signs of poor blood flow. And sometimes we think of that as being cool hands or cool feet, but that actually happens to all of us as we grow up. Really what we look for are signs that the muscles in the limbs aren't being well perfused. And we'd find that most easily when you try to go for a walk and the muscles cramp up early and make you stop for a moment to let the blood flow catch back up.
Very interesting. Okay, so how do you diagnose it?
We use really just physical examination as a good start. We'll feel the legs and the hands, feel the pulses and see if they're there. And then we move on to some simple testing with ultrasound to look at the blood vessels and measure the pressures in the arms and the legs to see if they're normal or if they're reduced. If blood flow is reduced, then there's more invasive testing with catheterization where we can look at the blood vessels and often just using a balloon or a stent reopen the blood vessels to restore that blood flow.
Okay, I'm gonna play the part here. I ain't got time for this. I don't have time for testing. I'll do it later. I'll get it. What can happen if it goes undiagnosed?
Well, that's really the danger of it, is if you let things get to the point where blood flow is so low that not only can you not walk, but then you begin to have pain when you're not walking, tissue can die. You know, without blood flow, without oxygen, skin dies and fades away and you end up with gangrene and people can lose toes or even more than that.
Wow. Really? Yeah. Amputation could be a... okay.
That's correct.
All right, so there are screenings that you can get done.
Yeah, PRMC does a great job of offering a screening service through our diagnostic vascular lab. When you go to one of the screenings, they'll measure the pressures in the ankle. They also look for other common vascular diseases, narrowing of the carotid artery, which can put you at risk for stroke, as well as the aneurysm, where the main artery in the belly swells and can rupture if it gets too large. Those screenings can be scheduled by calling over to our lab, and it takes, I think, about 10 or 15 minutes for them to check.
So is this an age-related thing? Is this something that'll...
It really is. It does. You know, again, it starts around age 60 is when risk factors begin to develop, and as you get older from there, the risk increases.
But the treatment, there is treatment.
For all of these conditions, and most of the treatments these days are very simple outpatient things.
All right.
Yep.
Dr. Douglas Wilhite, vascular surgeon with PRMC.
Thank you so much.
Great.
Thank
you all for your
very
time.
much for that important information.